Hi, how are you and how's everybody today doing? Our presentation today will be about the prevalence of alcohol consumption, tobacco smoking, and drug among youth in middle school students and individuals of 12 years old and older in the United States. So the two data sets that I will be choosing for my final project will be the DASH, alcohol and other drug use, and the second one is the National Survey on Drug Use and Health. And I have provided two websites for those two data sets. The most common 10 reasons that make youth abuse alcohol or drugs. One, first of all, is peer pressure, which is a potent force at any age, but it has its most powerful effect at the stage of adolescence. Because within any group of friends, saying no or refusing to do anything shared makes things difficult to be acceptable among this specific group. The body and self-image in order to feel grown up. Adolescents usually like to be treated as an older adults, and there is a common talk around them that says, I'm not a kid anymore, especially with some behavioral that they see its reflection of being mature, like alcohol or drugs use. The only thing that can prove to them the opposite is one harmful consequence or accident, unfortunately. The behavior of modeling parents. That can happen with adolescents that grew with their young parents who are also abusing alcohol or drugs. That makes the accessibility for alcohol or drugs much easier. Being curious, it's considered as one of the most potent and powerful seductive that can attract youth to the new stuff and pull them to explore the surroundings world. Since youth are less supervised compared to kids and children, that gives them enough time and chance for trying. Boredom. As they say, and as everybody knows, that idle hands are the devil's tools. That being said can lead us to the fact that much free time among youth can push them to be involved into troubles. Self-medications. Some adolescents and youth, even adults, believe that using alcohol or drugs and getting high is a good way to ease and reduce the pain that they could have. And also it can give them an opportunity to escape from struggling situations. Rebellion. Some parents can lead their children to start abusing drugs or drinking alcohol by the wrong, strict, overprotective way of dealing and educating them, which can guide them to start their passive-aggressive attitudes and behaviors. Ignorance and having fun. Most teens and youth are unaware of things that are good or bad to them and their health. Most teens who are abusing drugs or alcohol are doing that for having fun and can create a lot of stories that can go through them the following day or afterward. Becoming addictive. Most youth are not using alcohol or drugs for being addicted to it, but they are just using it for pleasure and fun without any goals or of addiction. Now let's move to underage drinking. As it's known in one of the studies, alcohol is one of the most commonly used and abused drug among youth in the United States. Extreme amounts of alcohol drinking is causing more than 4,000 deaths among underage people yearly, which costs the government of the United States about $25 billion. People between 12 and 20 years old are consuming alcohol around 10% of all people consuming it. Drinkers that are underage are consuming more alcohol in their occasions compared to older drinkers. About 190,000 visits of the emergency rooms are from persons younger than 21 years old because of injuries related to accidents due to drinking of alcohol. So let's move to the role of schools in drinking and drug abuse. Schools are the places where youth and adolescents are spending an important part of their life. Almost all schools are not responsible for the emotional issues of their students, but at the same time, almost all students are discussing their problems and issues among them, like drinking alcohol or abusing drugs. And because of that, schools is a vital environment to address youth issues and to apply appropriate changes. Addressing these changes is the bridge that links the prevention and the treatment. The successful school programs should be built upon two parts: the core team that gets courses of training and the system for referral and addressing people that need help. The core team is responsible for following up with these identified people in order to check of any required evaluation or interventions. Young people is the most affected group among ages and all stages of life. This composes an issue for the youth, their family, and their friends. Alcohol and abusing drugs is affecting all people using them by direct or indirect way, and in all places like houses, schools, dorms, and so on. About 23 million of people older than 12 months old are addicted to drinking alcohol. Drug abuse is also affecting many more millions of people. The age of first use of alcohol and drugs. What is affecting and compromising the development of youth brain is drinking alcohol or using drugs at younger ages. One of the studies proved that starting drinking before the age of 15 is associated with higher risk of dependence compared to people who started drinking at the age of 21. Family history of alcoholism or drug addiction also is a contributor factor also. The possibility of and the risk of addiction to drinking alcohol or using drugs is highly associated with the genetics that is the individual carries. Drinking alcohol and abusing drugs are not classified as moral problem or decreased the willpower, but in a simple way it's physiological effect combined with the genetic factor which compose a higher risk factor for addiction, like about 4 times a higher risk. Let's move to the consequences of underage drinking. Drinkers are more at risk for suffering from school problems like failing from their classes or being absent, less enrollment in activities of the youth, and fighting with strangers or sexual assault, being arrested because of reckless driving or causing injuries to others, health problems like hangovers or many other illnesses and disorders related to alcohol, sexual activity without any planning or any ways of protection which leads to sexual transmitted diseases, STDs, increased risk of committing suicide or even homicide, increased risk of abusing other drugs and having memory disorders, unintentional or not proposed injuries like burning or drowning, death, which is the most serious problem because of poisoning of alcohol. And here are some statistics of drinking alcohol among youth. We see that about a third of students drank some amount of alcohol, and about 20% rode with a driver who had been drinking alcohol. Here are some facts about teens and drug use. Teens with a higher death rate are those using drugs from prescriptions compared to those using cocaine and heroin. Older adolescents do not recognize that using regular marijuana is harmful for their body or compared to THC. About a third of teenagers who reside in states that accept using medical marijuana are approaching their pot from prescription from other people or peers. The population of the United States composes about 75% of taking prescription drugs all over the world, and about 60% of them are getting them for free. Recently, one medication that has been used for ADHD, which is Adderall, is being abused, and especially among the seniors of the high school. As we know, it's for memory refresh. Before teens reach the 8th grade, about 28% of them have drank alcohol and about 15% have smoked. Teens who received parental educations about the risk of drugs are less likely to abuse drugs compared to teens without any education. And also here are some statistics on teenage and drug abuse. We see like about more than 60% of arresting cases among underage people were positive when they went through the medical marijuana test. And there is one survey that is called Monitoring of the Future stated that using many drugs and substances is at the lowest number. Only a third of seniors students of high school believe that the legalization or use of marijuana is a good thing, and about a quarter of them believe that its use should be considered as a minor violation. The medical bill for using drugs is about $60 billion and about $100 billion for dealing with alcohol consequences and complications. Parents and youth families are the most important part of the loop on dealing with the high school students regarding alcohol or drug abuse. One of the most potent tools to be used by them is communication, free discussions, and continuous education about the risk of abusing these drugs. These are the methodology of using the database for the final project. So in order to use and analyze these datasets in the perfect way, information about the prevalence of drugs, tobacco, and alcohol, the usage should be gathered and then analyzed in a way that can make calculating these rates and comparing them among races, genders, and areas of residence is available. The organizations that collected these data: Substance Abuse and Mental Service Administration Centers for Behavioral Health Statistics and Quality. The aim for the outcome of collecting these data. The goals of these two surveys are determining the prevalence of drugs use of any health behaviors among these groups of people, and to specify if these rates are changed over time or not. Provide sets of data that can be comparable to on different levels: nationwide, tribal, territorial, or local, and finally to observe the progress in order to reach and approach the objectives of the healthy people. Stakeholders. Programs are being used for controlling alcohol and drugs among youth and adolescents, and usually being utilized in schools or colleges. These programs usually are being observed and monitored by local agencies of law enforcement, public health organizations that are community-based, parents and peers of youth, volunteers, people authorized for policy decisions, and researchers responsible for such projects. Many people or groups of individuals can be included as a core and vital stakeholders of drugs and alcohol policies, like medical professionals, psychologists, and social care workers, specialist treatment workers and treatment communities, officers and other staff in the criminal justice system, trade and industry group, researchers and media, a range of government departments and civil authorities, religious groups and institutions, and of course substance users themselves. Also, international agreements, regulations of the communities, and their knowledge are having an increased importance that can lead to external factors that can affect and influence. These external influence and stakeholders can be helpful in cooperating and monitoring the domestic values, policies, and checking the flexibility of them regarding any